So I know that there are many professionals in the field of aging in the virtual room today who are very familiar with this next slide and could probably lead entire sessions on this slide, but perhaps there are also some folks newer to the topic of dementia in the room today as well. So what is dementia? Dementia is an umbrella term for the loss of memory, language, problem solving, and other thinking abilities that are severe enough to interfere with daily life. Alzheimer's disease is the most common cause of dementia and accounts for about 60 to 80% of dementia cases. Other common forms of dementia include vascular dementia, frontotemporal dementia, and dementia with Lewy bodies. Dementia is caused by the damage to the brain cells, and that damage interferes with the ability of the brain cells to communicate with each other. And when those cells can't communicate effectively, that's when things like thinking and behavior and judgment can be affected. Some of the common symptoms of dementia, and they can vary widely from person to person, but include concerns with memory. That is the symptom that many of us are most familiar with. But other common symptoms can include challenges with attention, with communication, with reasoning, judgment, or problem solving, as well as with things such as visual perception. It's also important to know that dementia is not a part of normal aging. So to grow old doesn't mean that you will experience dementia. Next slide. Today, in the conversation about dementia-friendly communities, I want to set the stage first with some what I believe are critical data points. So when we're thinking about dementia-friendly communities and who is impacted, it's important to have these factors in mind. There are currently nearly 6 million people living with Alzheimer's disease, again, which is the most common form of dementia, but there are other causes of dementia. And it's been shown that statistically speaking, about 1 in 10 people, 10% over the age of 65 have Alzheimer's disease. When many folks think about dementia, they think of those in the later stages, but I also think it's so important to think of the entire process, the entire journey. And many people with dementia live at home or with family. That's 80% of people, in fact, living with dementia live at home or with family as compared to the long-term care sector. And it's also estimated that 1 in 5 people with dementia actually live alone. So when we're thinking about community supports, we're thinking across that spectrum of people living at home, those living with family, those living alone, but also those living in the long-term care sector as well. Next slide. And there are other factors that I think are important to keep in mind. I think it was Mary Grace, or was it Lynn, that shared the Washington State data points with, I think it was 300,000 caregivers. Across the US, there are roughly 16 million caregivers of people with dementia, and 83% of the help provided to people with dementia comes from family members, friends, or other unpaid caregivers. And on average, they're spending about 22 hours per week on caregiving responsibilities. And if you were to pay caregivers a nominal wage for that job, and it is a job, that would be valued at $232 billion annually for the economy. There's also been research done that shows that 83% of people with dementia have switched shopping habits to places that are more accessible, more dementia friendly. And I think that speaks to the outreach and training campaigns that I'll be touching base more on later in this presentation. And that $34 billion is lost in productivity due to caregiving responsibilities, which I think points to a need to better support caregivers in addition to people with dementia. So I hope those statistics paint part of the picture of the impact of dementia on people living with dementia, also care partners, and also businesses in the broader community and society as well. Next slide. Dementia can affect anyone regardless of culture, age, gender, income. There are certain risk factors for dementia. We do know that age is the greatest risk factor for dementia, increasing age. Most cases present with those who are older than 65. Other risk factors include family history, race and ethnicity. And I think the risk factor of race and ethnicity is so important as you shape your initiative and who you partner with and how you shape your work and making sure you have the right people at the table. But older African Americans are twice more likely to have dementia than Caucasians, and Hispanic people are 1.5 times more likely to have dementia than Caucasians. And factors like poor heart health and high blood pressure, high cholesterol, smoking can also increase the risk of dementia, as can things like traumatic brain injury. But as we consider the many phases of dementia, I also want to make sure that it's clear that many people don't fit the stereotype of being an older adult. There are about 5% of the people living with dementia are estimated to be under the age of 65. And so certainly people as young as their 30s, but also 40s and 50s and early 60s are diagnosed with dementia, and that's called young onset dementia. And risk factors for that can include head trauma, having Down syndrome, and in a small proportion, a genetic component as well. Next slide. And so everyone wants to live their best life. I think we can all say that we want to live our best lives, and that doesn't change with the onset of dementia. And I like this phrasing. It's from the Global Charter on Dementia, which was developed by people living with dementia. And the central tenet is that people want to live well with dementia. And really, that's what Dementia Friendly America is on a mission to help support. Next slide. So the Dementia Friendly America initiative has set out to foster dementia-friendly communities across the country. There are now 300 dementia-friendly community efforts across the country. Dementia Friendly America launched in 2015. It's modeled after Minnesota. There's a great initiative there called Act on Alzheimer's that launched back in the early 2010 timeframe that established a structure and a process for how communities can join together as a community collaborative and work together to become more dementia friendly. And that work was just spotlighted and seen by national leaders and Minnesota leaders, and folks came together and said, okay, this is really great for Minnesota. And there were other states, Wisconsin, working on dementia-friendly community efforts too, a lot of work internationally. But how could we take that model and make it available, not just in a couple areas, couple states, but make it available more broadly and make the tools and supports available to folks all across the country? And that's what Dementia Friendly America is. And Dementia Friendly America is a really grassroots model. It provides a structure for communities to convene and analyze their needs and to develop an action plan to better support people in their communities. Dementia-friendly communities are guided at their heart and shaped by people living with dementia and their care partners. And our thinking is, we know there's not a treatment or a cure available. There are some drugs in the pipeline that have some promising aspects to them. But until there is a treatment or until there is a cure for people at all stages, it's just so critically important to support those that are impacted by dementia. And also, I'll be talking about this a little bit later in the session, but in addition to supporting dementia-friendly communities, and there was a tidbit about this in my bio, but we also administer a Dementia Friends program, and that's a public awareness campaign. So dementia-friendly communities are aimed at community-wide impact. Dementia Friends is really aimed at the individual level, but a lot of times these efforts interweave and mutually support each other at the local level. Next slide. I always like to recognize our partners because we do this work in collaboration with a lot of partners and funders as well. So this slide recognizes some of our key partners. The purple color reflects into those that are our funders, including the National Alzheimer's Association, Leading Age, Home Instead Senior Care, the LEAD Coalition, Us Against Alzheimer's, AARP, but many more partners contribute to our work. Next slide. And Dementia Friendly America, our belief is that it takes a village, it takes a community to support people with dementia and their care partners. And the vision is that each part of a community can play a role and can do its own unique thing to help foster and create a more dementia-friendly culture. And that's what this cloud image represents, is how each and every different sector of a community can do its unique thing. So just to say a few examples, businesses, they can support customers with dementia, whether perhaps as retail businesses or banks or financial and legal services. And they can also support their employees who are caregivers. Healthcare systems can promote early diagnosis and options for ongoing care. Communities of faith can provide welcoming and engaging environments for those with dementia and their care partners. Local governments, a critical partner, plan and implement many factors that affect people living with dementia, whether it's housing or transportation or public spaces. Also first responders who encounter people with dementia in a variety of settings. Community-based services can be better equipped and well-trained to support people with dementia. We all play a role, whether it's also neighbors, community members, youth, to have a better understanding and be more supportive to those around us. That's also where the Dementia Friends program often ties into broader community efforts. And residential care to support those and to maximize independence and support ongoing community engagement. Next slide. So one of the common questions that we get, and so I always like to touch on it, is just, what is a dementia-friendly community? How do you define one? How do you know when you are a dementia-friendly community? A dementia-friendly community is one that's informed, safe, and respectful of people with dementia and their families and caregivers, and provides supportive options that foster quality of life. And so a dementia-friendly community is a place where people are able to live their best lives. They have the ability to live as independently as possible or as independently as they choose, to where they continue to be part of their communities. A dementia-friendly community is one where people with dementia are met with understanding, and also one where they're given support when it's necessary. Next slide. In terms of the goals that many of the dementia-friendly communities work towards, these are some critical goals. For example, increasing awareness and understanding of dementia, developing a culture of respect and inclusion for people with dementia, embedding services and supports for people with dementia across community sectors. And when I say community sectors, I mean those groups that I had referred to on the cloud side. So whether it's businesses or libraries or local government or healthcare or faith communities. Another goal is to educate people with dementia and their care partners and families from early stage through the disease journey, making sure they have knowledge, trainings, and resources that they need. Also providing social and cultural engagement opportunities. And we know how important social engagement and addressing social isolation is. I think the COVID pandemic has shone a spotlight on how important it is to not be socially isolated. We need to continue social engagements even through challenging circumstances. Next slide. Additional goals include of dementia-friendly communities are having more available services and supports for both people with dementia and care partners, as well as looking at the physical environments of how the actual environment of places, of whether it's a park or a business or a faith community, can be equipped to make it accessible for people with dementia. And so it's an important aspect of many of the trainings and outreach that our dementia-friendly communities do. And I'll be touching on that in a little bit more detail further in the presentation. But the next slide, and I guess, Mary Grace, before you hit the play button, just to set a little framer, the next slide has a video that highlights the Dementia Friendly America movement, why we do the work we do from the perspective of some national and state leaders that have helped to shape the initiative. So with that, Mary, you can go ahead and play that video.
It is not a failing of character. It is not a weakness. It is a disease. And so we must disentangle this notion that dementia is a natural part of the aging process, or that it's something to be ashamed of.
I was ignorant about the disease when I was diagnosed, and so I had to get in and learn, and I didn't want other people to be ignorant either. My whole focus has been trying to educate, advocate, and help bring awareness to the disease.
A dementia-friendly community is a community in which every sector of community steps up and does its unique part in making sure that those who are living with dementia in community can continue to access community services and support.
Dementia-friendly is a state of mind. It's a state of being. It's educating others that you can be inclusive. All of your family members can be at the table, including the person that has dementia. They do not have to be excluded.
It's my hope that through Dementia Friendly America, that people will walk towards people with dementia and see how they can ensure that they are part of the community rather than walking away and making them feel isolated.
The best way for an individual to get active in the dementia-friendly movement is actually to go to dfamerica.org, where you can go online, get a basic education about what dementia is and how to respond to people with dementia, and participate simply as a member of a community in helping the community become more dementia-friendly.
What a world of difference that would make in the daily lives of people with dementia, caregivers, tourists, and anyone else in that community. No judgments, no preconceived notions, no fear, no resentment, no pause, just help.
Thank you for the AV assistance there. I just like how that video shows others that are so committed to this work and their descriptions of why the work of Dementia Friendly America is so important. Now, up till now, I've spoken, and with the video as well, we've heard about the why we think this work is so important. But next, I wanted to get more into the how, and then also the what, in terms of what dementia-friendly communities are doing, and to give some really specific examples of dementia-friendly community actions. Next slide. So with Dementia Friendly America, as a national initiative, what we do is provide technical assistance, tools, and resources to help communities and individuals take action to become more dementia friendly. I'll go into a lot more detail on these tools in the workshop session tomorrow, actually, on the 4-step Dementia Friendly America process, but I wanted to just provide a quick snapshot here today, especially for any folks that can't attend that workshop tomorrow. But our website includes hundreds of materials. We have sector guides that provide specific guidance on how to partner with different sectors, again, whether it's partnering with business or faith, communities of faith, or libraries. We have provider tools aimed at the healthcare audience, as well as provider videos. And we have our comprehensive Dementia Friendly America community toolkit that offers guidance for communities that are working to become more dementia friendly. The goal at the national level is to help communities by laying out a roadmap that you can pick and choose pieces from. It's a grassroots model, so we are all about what will work for you in your local community. And all of our resources are free, they're downloadable. The vast majority are Word documents or PowerPoints, so that means that they're customizable also to meet your needs as compared to PDFs that you can't edit. Next slide. The 4-step toolkit guides the community process, and our aim is to guide that community process with enough structure to help groups come together and to create a shared agenda, but in a way that's flexible enough so that communities can define their own goals and approach the work in a way that's most suitable for that local community. But the overarching steps are 4 steps are: first, convening key community leaders and members and forming an action team. In this, as well as in other steps, all the steps, but this is where it's so important is when you're starting your dementia-friendly community initiative to have the leadership, have the inclusion of people with dementia and care partners. But also critically important is to include diverse perspectives, whether it's individuals of different races or ethnicities, religions, or immigration statuses, or sexual orientation. Having broad input will help you shape your initiative and develop an action plan, the final step, that meets a broad array of community needs. The second step is to engage those key leaders, to assess the current strengths, but also the gaps in your community in terms of surveying and supporting people with dementia and their care partners as effectively as possible. And then based on that assessment of those strengths and gaps, and knowing that it's very difficult to do everything, or it's very hard at least to do it all at once, is to analyze those needs and determine priorities and set community goals. And oftentimes this is where you're establishing those goals that perhaps align with your staffing availability, the availability of the volunteers on the action team, and also any fundraising. And then finally, acting together to implement dementia-friendly goals, and then identifying ways to measure progress. Some communities, as I mentioned, I think a moment ago, do go through the toolkit in a very step-by-step approach. Others pick and choose resources that are most beneficial for them. One example that we've seen some communities do is if their community already has a senior task force or a coalition on aging of some nature, sometimes groups have expanded those efforts to include a dementia focus and include additional partners and additional stakeholders, but they didn't start from scratch. And we fully support that. We don't want communities to duplicate existing work unless they feel it's most helpful to have a separate and different action team. Certainly that happens regularly too, but this is just an example of how this can reinforce existing work and build on and amplify, not duplicate. Next slide. And joining Dementia Friendly America, a lot of times folks, because there is a way that communities can join up with us, all our materials are freely available, so you don't have to be a member of DFA, but you can if you wish. A lot of communities think that means that they're at the end of the process, that they have become dementia friendly. We really frame it as you're working to become more dementia friendly as a community. You're embarking on this process. So it often means that when a community joins up with Dementia Friendly America, they're actually more at the beginning stages of the process and close to it. And we hope that's the case, really, because then we can better connect you to resources that we offer, whether it's staff assistance, having brainstorming sessions, or our webinars that we do and the like. But other simple steps include defining your community. How you define your community is up to you. It can be your local city, your small town, your region, your county. And we've also had instances where it has changed, or grown would really be the more appropriate word. We've had some communities start small as a small town and then broaden out to a dementia-friendly county initiative. So sometimes it's important to think about potential growth opportunities, as that might affect even how you initially plan for branding or communicating your initiative. Another simple step, of course, look at that toolkit that I was just mentioning a moment ago with the 4 steps. Again, some communities go step by step. Others pick and choose resources that meet the needs and the areas where they feel like they need some more guidance. It's always helpful to start with many of our dementia-friendly community initiatives. Start with a couple or more, but at least a couple passionate individuals in your community. And perhaps you're one of them. You're here on this conference today and tomorrow. But it's okay to start small and build up from there. Just start with a couple, yourself and 1 or 2 other people, and have a brainstorming meeting. We have sample agendas on our website that might be helpful for you. Of course, you can always connect with Dementia Friendly America for more assistance and support. Next slide. So with that said, a description of some of the resources we have, you might be thinking, okay, I know it's important. I've heard some of those statistics. Okay, I've heard about some of the resources. That's helpful. But what does a dementia-friendly community actually look and feel like? What activities are dementia-friendly communities doing? So in the next several slides, I wanted to go through some examples. So next slide. People with dementia and their caregivers frequent businesses. Of course they do. You might remember the fact earlier in the presentation that said that 83% of people with dementia have switched shopping habits to places that are more accessible. And that's a hook right there for engaging business partners. So how can businesses, again, whether it's retail, banks, grocery stores, restaurants, be more supportive? A dementia-friendly business is one that can recognize the signs that someone may have dementia. We're not asking them to do diagnostics, but just some, be aware of the general signs, that they have some basic communications tips, and that they have an understanding of environmental factors that can support or hinder accessibility for people with dementia, whether it's not having clear signage. We've all seen the bathroom sign where it's a hen and a rooster and it can confuse anybody. Whether it's having highly distracting carpets, whether it's having music that is way too loud, whether it's having really shiny surfaces that are just hard to discern. So those are all important factors with dementia-friendly business or organization training. We don't expect businesses to overhaul their environments right off the bat, but if they're doing a refresh at some point and they have an opportunity to swap out a carpet that maybe is just a really confusing pattern, that would be a great time to become more dementia friendly in your physical environment. Other things are more simple and can be done promptly. Streamlined menus, clearer signage at the bathrooms, and the like. So many of our community efforts partner with local businesses on training campaigns and provide decals and recognition to those that meet the criteria, including receiving training, a certain percentage of staff, and a commitment to ongoing training. And the next slide shows a video of a dementia-friendly community business initiative in Wyoming.
My name is Linda Fouth. We sell Crazy Woman logo clothing in historic downtown Sheridan, Wyoming. I got my name from Crazy Woman Canyon, which is in our mountains, and Crazy Woman Creek. And the name just makes people smile, so that's why we picked it. We had an incident that embarrassed us, embarrassed the people in my store. I'm a nurse, and I still didn't know how to react. And then Kay came along and told me about her project, and I just teared up and said, you have to help us.
The business community is our #1 goal because we want people living with dementia and their care partners to feel welcome wherever they go. You'll see the stickers on store windows that say we are dementia friendly. If they have 50% of their employees trained, and they also look at their environment. They begin to look at their environment and think about simple ways that they can make changes to make it more welcoming.
It's not about spending a lot of money to make new changes. It's simple things like to have a quiet space, whether it's a fitting room, a chair in an office, a chair in a corner, a mat at your doorway.
As you look down on the floor here, as you step into the store, it's black tile. I would see people come in and they would tap at it, like, you know, is it safe to step here? So we got our bright red rug, and I think more importantly is our knowledge. I can now make them feel comfortable, and I can make the family feel comfortable and let them know they're welcome in our store. I'm so happy to have my business be dementia friendly.
So little things like that don't cost a whole lot of money. And now we're beginning to work on the big businesses like Walmart and Home Depot and the government, city government. We've already trained a lot of the county employees, but we know we're just beginning to touch what's out there and the people that need the help.
Thank you. Excuse me. And you can go to the next slide as well, but I thought that just gives such a flavor for the importance of this work, but also easy steps, simple steps that any business or organization really, or any location can do to be more supportive. And And on that note, in terms of partnering with faith communities, there are so many dementia-friendly community efforts that partner with communities of faith. Examples of these partnerships might include holding special services at the faith community, perhaps one that is shorter or simpler, that is aimed at people with dementia. We have also had faith communities do things like recruit volunteer buddies to help make sure that the care partner can attend that full service without distractions. And if their loved one with dementia needs a break or needs to step out, the volunteer buddy can be with them during that and provide some companionship. They can also serve as a local spot for memory cafes or support groups. Memory cafes are social gatherings aimed at bringing people with dementia and care partners together so that they can have a social gathering with folks that are on a similar journey. Faith communities can disseminate information through bulletins and make sure that folks are aware of local resources and supports. And we also know another activity is that we know music is increasingly being used to enrich the lives of people with dementia. And so we've seen dementia-friendly choirs and church choirs, and they can be dementia-friendly by simple steps, again, having daytime practices, looking for accessible venues, and choosing songs which are familiar to many people. Next slide. Other examples, healthcare professionals across the continuum can play such an important role for people with dementia and their care partners. So whether it's primary care, pharmacists, nursing, dentistry, specialty care, or other roles in the healthcare sector, they can promote early detection and diagnosis using the latest protocols. They can connect people with community resources that can help promote their quality of life. They can support the care partner's needs and also address home and personal safety and information that will just support overall independence. We're seeing a lot, or quite a few at least, of dementia-friendly hospital initiatives. And we're also seeing even activities like dentists working to be more aware of dementia and how they can have dementia-friendly practices and continue to do screenings and assessments and treatments, but also work with caregivers and support them on oral hygiene. Next slide. Local governments are also critical partners with their leadership role in many facets of our everyday life, whether it's housing, transportation, first response, parks, senior centers. There's a lot that can happen with local government and the public sector. I'll just give a few examples. With law enforcement and first response, again, they have a lot of connections to people living with dementia, whether it's through wandering or driving issues, or people calling 911 and perhaps being confused by a stranger in their home that's a stranger to them, but perhaps is actually, you know, a family member or friend. So having that general training, having that awareness, having strategies to communicate effectively, de-escalate. We see a lot of communities that are working to train 100% of their frontline police, fire, and EMS. We also see a lot working on initiatives like safe return initiatives, making the community more aware of kind of the bracelets and the necklaces that help connect people if they are wandering, and providing contact information so they can get back home safely. In terms of parks and recreation, again, there's a lot that can happen there, whether it's holding dementia-friendly events with appropriate seating and signage and wayfinding, whether it's hosting memory cafes, which are such a common or increasingly common activity that communities that do them just so value having that additional resource in their communities. Transportation is often a role that the public sector is working on. But how can drivers be better equipped with knowledge of dementia? Perhaps also collaborating with local taxi companies, particularly in rural areas where there's less public transportation, but there might be taxi companies that people are relying on to get around, making sure taxi drivers are trained. We've certainly seen that. If there's a volunteer-based transportation initiative, perhaps it's through a local neighborhood village, again, making sure those folks are trained. Transportation is such a critical issue to ensuring people have access to basics, but also basics plus. So whether it's groceries, whether it's doctor's appointments, but also those connections with other people that we do need. Of course, in today's times, we need those to be safe, but we need transportation to continue that access. Senior centers, also whether they can train staff, perhaps encouraging everyone to be a dementia friend, hosting memory cafes. There are so many ideas that within each of these sectors, there are simple strategies that communities can take to be more dementia friendly. Next slide. And I also do want to say, I know I'm providing a lot of examples, but keep in mind that you don't have to do all of this. You can start small and then grow. So hopefully this is giving you some ideas that might resonate and say, oh, we have a great library in our community. That would be a great place to start. And then we'll build into businesses or other sectors. So it's okay to start small and grow. But on that note, libraries provide so much community support, resources, and services, and they can be a really fabulous partner for dementia-friendly community initiatives, whether it's training staff and staff can become dementia friends, for example, whether it's hosting memory cafes or other special events, whether it's offering library materials that are specifically aimed and geared for caregivers as well as people with dementia. Perhaps it's offering individual appointments for people with dementia to help them choose materials that might be of interest. Maybe it's doing a special display on National Family Caregiver Month or Alzheimer's Disease Awareness Month, not only to support people with dementia and caregivers and make sure they know about those resources, but that also has the impact of raising broader community awareness. We also see many communities libraries creating things like memory boxes or reminiscence kits for patrons to check out as well. Next slide. There are a lot of amazing opportunities to partner with youth and young adults, whether it's from the very young to the college age young adult. Just to give a few examples, in high school, we see Dementia Friends content being incorporated into curriculum. We see college students opening up chapters of the youth movement against Alzheimer's. That's an organization. They have campus clubs all across the US at colleges, but you can open a new one at your college if that hasn't happened yet. There's a Girl Scout in Minnesota, Edie Weinstein, who wrote a book called Lucy and Grandpa about a grandfather with dementia. That is now being taken to youth groups and used as a discussion guide for groups all across the country. So there are so many innovative ways to engage with youth. Next slide. And there are also many innovative ways to engage people with dementia in the arts and cultural opportunities, whether it's a dementia-friendly museum exhibit or tour. And I think there's a bit more information coming up on that at the conference. So there can be special tours and exhibits. A lot of this work stems back to an initiative called Meet Me at MoMA that has some really great toolkits and resources. We've also seen communities do dementia-friendly zoo experiences that can include a tour and conversations with staff and activities to engage. They're dementia-friendly symphonies, but also remembering that people with dementia can give back. Certainly there are volunteer programs that engage people with dementia as volunteers. So volunteering at local food banks or early stage phone support programs where it's people with dementia mutually supporting each other through friendly visiting programs as well. So there are a lot of ideas, dementia friendly film events as well. Next slide. And you might be thinking, okay, this all sounds good, but a lot of this, is pre-COVID examples. How is it working during COVID? And certainly we have seen communities have to pivot, that's for sure, as we all have, but communities are continuing to come together and innovate. So we have communities that, first of all, are gathering feedback from their stakeholders, particularly people with dementia and care partners. What do you need most right now? They're ramping up outreach campaigns. They're adding information on their websites. They're doing community drives to send postcards or notes to those that are isolated, particularly long-term care residences. They are organizing virtual events, whether it's a virtual memory cafe, a virtual choir. An organization Giving Voice has resources on that. Whether it's a virtual community wellness event, hosting a webinar to simply raise awareness about your work as well. So there's a lot that can happen even now, despite the challenges of COVID. Next slide. I wanted to just reinforce, but also provide some ideas for how people with dementia and care partners can be really lead and be highly included, but also lead and shape these initiatives. So there are different ways to do that. People with dementia and care partners can participate on the action team, but if that's not comfortable, or perhaps in addition to, you can gather feedback from focus groups, one-to-one calls, or other meetings. It is important to, if you're having convenings, look at dementia-friendly meeting principles. I have a quick slide on that. You can co-facilitate and lead trainings with people with dementia. And there are also ideas like friendly visiting at local dementia-friendly businesses to kind of see how they're doing after they've received the training. Next slide. In terms of dementia-friendly meetings, these are just some tips, and there is a resource on this slide that has a lot more information, but simple tips include avoiding late afternoon meetings or evening meetings. If there's travel involved, providing an assistant, probably won't be doing that for a little while in terms of in-person convenings. Ensuring people are aware, greeters are aware of dementia and simple tips, having clear and visible signage. One that I think is especially important, in addition to using respectful language in terms of not avoiding words like not suffering from, but people with dementia have the choice as to whether they disclose their condition, so they can participate as a community member. They don't have to disclose that diagnosis. That's up to them if they want to as well. Next slide. Co-facilitating and leading trainings. A lot of activities that community efforts do oftentimes are doing outreach, raising awareness, holding trainings. When a person with dementia is involved in the presentation or even co-facilitating, the feedback we've heard is that those trainings are just that much more powerful. So a person can provide opening remarks and framing and provide that personal perspective, or they can co-deliver the presentation along with a staff or another volunteer. That's up to you and to the comfort level of the person living with dementia. But again, the more involvement, the better. We've also had groups do dementia-friendly organization visits. So that might be a person living with dementia or a care partner visits the dementia-friendly business after they've received training to observe strategies being used and provide that helpful feedback back to see perhaps if additional tips or training sessions might be helpful. That was actually done in Dementia Friendly Shared in Wyoming, which is the video we saw a few minutes ago. As we wrap up here, I know I just have a couple minutes left, so I will try to move quickly, but to share a little bit more information on Dementia Friends, since I've mentioned it a couple times. That's part of the global movement, changing the way people think, act, and talk about dementia. So a dementia friend is someone who learns a little bit more about dementia through an information session or through our online dementia friend option, and then turns that understanding into action. So there's a call to action at the end. What will you do now as a dementia friend? Can be an action big or small, whether it's offering to help a neighbor, volunteering, donating, it can be anything. We lead this program in the US, and there are over 85,000 dementia friends in the US. Next slide. Dementia Friends is one component of broader dementia-friendly community efforts. So whereas Dementia Friends is really aimed at the individual level, dementia-friendly communities are aimed at the community-wide level in terms of impact. But again, these initiatives really reinforce and oftentimes work together at the local level. And the Dementia Friends program is active in the state of Washington. It's currently active in 24 states, but certainly in Washington as well. So I wanted to be sure to have a little more info on that. Next slide. These photos do show Dementia Friends pre-COVID. But certainly as a result of COVID, many of our Dementia Friends programs have pivoted to online sessions. And again, we have 85,000 Dementia Friends currently. So I think I have time to show one last short video. So Mary Grace, if you would play that.
If you saw someone living with dementia, would you recognize the signs? Would you be uncomfortable? Would you avoid them? Would you be frustrated? Would you do nothing? Or would you be a friend? Would you engage them and empower them to get through their day? Would you welcome the opportunity to help them feel like a part of your community? Would you take even the smallest step to make their world less frightening or confusing? Every single one of us has a unique part to play in the lives of people living with dementia in our community. Become a dementia friend today and build communities where all people can live, age, and thrive.
Hey, Mr. Fredrickson, it's Tuesday. Aren't you going to the store?
Yeah.
Come on, I'll walk with you.
Find out more at dementiafriendsusa.org.
Thank you, Mary Grace. And so just to conclude, Dementia Friendly America does have resources to support you, whether it's our online materials, but also if a community does join up with us, whether it's the webinars, our Google group, additional technical assistance, even access to branding that communities are welcome to use. So we hope you consider us a resource. And with that, thank you for your time. And thank you to the team putting this on for inviting me to share a little bit more today.
All right, so our discussants for this keynote are, well, Meredith Hanley will remain on the stage, but she'll be joined. Just picture in your mind that there's a few armchairs up on the stage, and we're welcoming David Brown, writer and speaker on his personal experience with memory loss due to Alzheimer's disease, Lynn Kimball, Executive Director of Aging and Long-Term Care of Eastern Washington, who's been instrumental in spearheading dementia-friendly Spokane County, and Dr. Raina Croff, Assistant Professor of Neurology with Oregon Health and Science University, whose research focuses on culturally celebratory approaches to promoting cognitive health in Black communities. Discussants will respond to 2 questions, one question at a time. I'm just taking a couple minutes for each one, but the questions are: what most stands out to you from the keynote presentation? What 1 or 2 ideas most resonate with your personal or professional experience? And the second question, let's imagine we achieve our goal of expanding dementia-friendly communities throughout Washington or even the nation. With Meredith, what's one way that achievement of our goal would impact the communities you're connected to personally or professionally? What change would you be most excited to see? So I'm going to pull that down and welcome first to the virtual stage, David Brown. Dave, if you want to go ahead and unmute yourself, perfect. And if you'd like to just start with that first question of what most stands out to you from this keynote presentation.
Okay, thank you, Mary Grace, and I appreciate being invited to speak. Let me just spend a few seconds talking about why I was invited here. And that is because in 2015, I was diagnosed with mild cognitive impairment due to Alzheimer's disease, and I was in free fall. I was having episodes where I couldn't remember my phone number or my zip code of 30 years. I had to stop driving. In the last video that Meredith showed us, there was a woman standing at the crosswalk, and the light turns, and she's supposed to walk, and she doesn't know what to do. And I had that exact same experience in 2016, where I'm trying to cross the street. I can't drive. I'm walking everywhere or taking the bus, and I want to cross the street, and I can't. I can't figure out what's going on. What am I supposed to do? So that really resonated with me. I went to Harborview And when I went to Harborview, they gave me a list of, they diagnosed me, and they gave me a list of things to do with my exercise, diet, getting good sleep, a bunch of things like that. And I went and did all that stuff and had a remarkable reversal of my symptoms. So today I can function, I can drive, I can function like anyone else. And it's just almost miraculous. Now, I'm not cured, and it'll kill me in the end, but I've bought probably, I'm hoping 10 years back from this disease. Now, I was watching what Meredith had to say to us, and there are several things that struck me. One was her discussion about the entire journey, because that's my perspective, starting out with just having issues with just normal things in my work. And then that getting worse and worse, having episodes of dizziness and depression and those sort of things. And that was, and then being at the edge of actual dementia in 2016. And she portrayed that as a journey, and I see it that way too. That was very helpful. I want to say also that I went through the Toolkit, Dementia Friendly America Toolkit, and the tools in there are just amazing. I cannot say enough about the breadth of what's there, the quality of the material, and I would certainly recommend everyone go there and take a look at and see how you can take those tools and apply them in your community. Now, the one last thing I wanted to mention is she talked about education as a goal, and the thing that has been my motivator to write my book and to speak to people is that I need to, is people need to understand more about it. And my time is up, and I'm going to sign off.
Thank you so much for your comments, and also for modeling. Keep it to the timer. We appreciate both of those. Thank you. Lynn, I'd like to pass the virtual microphone to you. What one or two things stood out to you from that keynote presentation?
Great, thank you so much. So one of the first things that stood out to me was right at the beginning, the statistic that 80% of people with dementia live at home and with family. So we often in society, we have this view that once you have dementia, you go off to a facility and it's your end of life and life is over. And it is such a misconception and misperception. That's why dementia-friendly communities is such important work, is to really empower individuals and families and communities to really help people live the best lives they can for as long as they can. You can have wonderful quality of life while living with dementia, and really it's those supports that are so important. So for me, really looking at dementia-friendly communities is a way to really see how do you, as a community, come together to support people with dementia, support their care partners. It is such a critical part of the planning process and that toolkit to make sure people with dementia and their family members are part of your planning and really have a voice and have a say and can really help direct the rest of us to really figure out, okay, really what differences can we make in our own communities, whether it's the grocery store, whether it's the hospital, whether it's in-home services and supports, really figuring out how do we tailor those services to make them as supportive and friendly as possible. And to me, that's the big challenge of Dementia Friends and dementia-friendly communities is really how do you help systems really get that education and then really look at how do you take what resonates with your community, because every community is different, and really start tackling those new programs or services or even just adapting and training so that people are supported.
Thank you. Thanks so much, Lynn. And I definitely appreciate your leadership in your region around that.
Thank you.
Dr. Croft, I'll hand the virtual microphone to you. What one or two things stood out to you from that keynote presentation from your perspective?
Well, hi, everybody. It was a wonderful presentation, and I just wish that inspiring music in the videos could just be the background to everything we are saying. I'm feeling this energy and this excitement about how possible this truly is. And the thing that stuck out to me, as a cultural as a medical anthropologist, it takes a village, we've all heard that. It takes a village to create this dementia-friendly culture. And when we walk around in our spaces and when we interact with people, we're not thinking about the rules and the laws of culture. We just are. It's this innate quality of how we interact with our world. And I want that same feeling to continue with people living with dementia and their caregivers, that they don't have to readjust themselves and how they will interact with the outside world, but they rather enter into this partnership with the external world, you know, that we are not alone, that we're in this together. And there's this Hosa spirituality philosophy from Southern Africa, and there's it's called Ubuntu, and that means I am because we are, right? And an individual exists interconnected with their community because there is a community, and they are able to be who they are because of the community. And so, you know, people interact with every part of their community. I think that was something that stood out. So it takes every part of community to be a part of the solution. And that's so powerful because being seen in itself is such a statement that says, I am still here and I count. I'm part of this community and I deserve interaction, but more than that, I deserve effective interaction. And there was mentioned, you know, those questions, will you avoid? Will you be frustrated? But we want people to enter into this feeling when they are frustrated and they are confused, that they're not met then with frustration, that they're met with this sort of gentle receiving, and they are not mirrored back their own confusion and frustration, but rather they're given this patience and really this love of being. And it makes me think of what Nancy Kinsman says, being in the moment together, that it's just taking that extra few minutes to just be in the moment with that person and providing the level of care and assistance and just human understanding that person needs, so that they can continue to feel like the world out there is a safe place for them to be exactly who they are as they're living with this change in their life, rather than feeling that they have to readjust and maybe become fearful of going out, which means they will restrict their social activity and their physical activity, which then just exacerbates the problem. But I have a few seconds left and I want to end on a positive note. I just really believe that this is totally a possible cultural change. And cultural shifts, you know, they don't just happen. They are evolved and shaped by the people that practice them. And these are relatively easy and simple practices that I believe can become just a normalized part of the fabric of our culture and society. Thank you.
Thank you so much, Dr. Croft. I am hopefully going to get through this without crying from inspiration. It is possible. I absolutely believe what you just shared, and I think we all here are here because we believe that it is possible. Thank you so much for bringing that perspective of we are because, I'm going to mess up this quote, I am because we are, that type of
exactly.
Like we're all in this together. It is a partnership. Thank you. Meredith, do you want to comment very briefly on what you just heard, or I'll go on to the next round if you don't have a comment right this moment?
I mean, it always makes me question why I'm here, because you guys get it. You guys get it and speak about this so effectively. And I just think that's awesome and so great to hear. I always feel so inspired by these types of events. So just thank you to the other panelists, but also thank you to everybody in the room. And I think, yes, we can make this doable. We can make this simple. It is starting. You do have to start somewhere, but start somewhere and you can take it off in bite-sized chunks. But it's better to do something than to do nothing. So again, resources are here to support you, but yeah.
Thank you. Thanks so much. All right, our last question, we'll just go through the same order here. It's so imagining, kind of picturing we achieved this cultural shift that we're talking about that is possible, where, you know, people with dementia are fully welcomed, included, and participating within community life. What's one way that would impact the communities you're connected to personally or professionally? You know, what really excites you about that kind of change? Dave, you want to start off?
Yeah, the thing that is motivated me to write my book, motivated me to speak to people like this venue, is a sense that when people are first diagnosed with cognitive impairment, as I was, aren't given a whole lot of help in what to do next. What are the resources available to you in your community, that sort of thing. I got treated really well at Harborview, but I live in Tri-Cities, which is a couple hundred miles away. And so the scenario here is really quite a bit different. And I'm looking for city governments to take the initiative, and the Chamber of Commerce to take the initiative on something like this. And with the hope of seeing the things that we saw in the video be reality that Meredith showed us a little while ago. And I am particularly interested in seeing that when a primary care provider or neurologist diagnoses someone with memory loss, that they are directed to resources right there, because that is ground zero. That is where, I'll tell you right now, it is really impactful to be sitting in the doctor's office and be told that you have Alzheimer's disease. And so the first question is, what do I do now? And this is why I appreciate Harborview, because they told me this is what you got to do now. But that's not the rule. That's not what most people experience. And I would like to see that promulgated out to medical professionals throughout the state, that here are the resources in your community. Here are the things that you want to tell your patients when you give them that diagnosis that will help them to improve their lives, direct them to resources. And we do have some nice things. For example, in our library here is doing memory cafe kind of activities. And so how do people even know about those things? How do they learn about them? And that's what I'm hoping more than anything to see grow out of this.
Yeah, absolutely. I love it. So in your dementia-friendly future, all medical providers would be equipped to be able to pass out resources right at that point of diagnosis.
That's right.
Get people on that positive journey. Thank you. Lynn, how about you? In your dementia-friendly world, what change would you be most excited to see? How would it impact the communities you're involved with?
Great. Well, I really think from the get-go, if our community was dementia-friendly, people with dementia and their loved ones would receive support and understanding. And that inclusion instead of isolation, because so often what we see is people end up isolated. If they do get a diagnosis, which it can be really, really hard to even get the diagnosis to begin with, it's almost seen as this life sentence and their life is over and that's it. There isn't that referral to resources, to community, to support, all of those things that your life isn't over. You can actually plan, there's things you can do in early stages to help maintain your quality of life and really live the best life possible. So I really see if we had that complete culture shift, like Raina mentioned, that would be wonderful. That would be the ideal to me. And then just seeing how it shows up in all of the different places that we interact on a daily basis. What programs do we then see in our Parks and Rec departments, in our library system? What things do we see in our faith communities and helping people really continue to worship and be part of a community even as they experience dementia? And really looking at all of those different supports, from making sure people can get an appropriate diagnosis, and when they get that diagnosis, there's a referral to Alzheimer's Association or the Area Agency on Aging or local support groups, to something to give them more information and help to plan. And really also looking at the medical system and our legal system, that they are educated as well on how do you work with people with dementia and their families. And really, if someone is wandering and aggressive behavior in their community, that it might not be a mental illness and you might be able to redirect, and this person has a family and has supports and everything else, and maybe an institution isn't the right place for them if you can get the right supports. So I really see that culture shift would be my absolute ideal.
Thank you, Lynn. And Dr. Croft, in your dementia-friendly future, if we achieve this culture shift that you spoke of, how would that impact the communities that you're a part of, and what change would you be most excited to see?
Well, what I was hearing a lot from older Black adults that I work with who are realizing they have mild cognitive impairment, or they realized, or they got the diagnosis of their loved one has mild Alzheimer's disease. For me, the thing that I would love to see is a shift in the feeling of the diagnosis. You know, that dread rot feeling that it's going to be me against the world, or it's going to be me and my partner against the world. How is my mom going to be treated? Are they going to recognize her in her fullness of humanity, who she is and who she was? Is she going to be treated with dignity and respect? But if we have this totally possible cultural shift, right? I mean, it is realistic and it is achievable because of three things. Excuse me. People want to help, right? There's this innate quality in people. They want to help. They just get confused or unsure of what is the appropriate thing to do in this moment. And this can take the thinking out of that moment and just the innate doing, right, of how we interact with somebody. The second thing is that service people, you know, at the banker, waiter, store clerks, it is their job to help. So this is just putting another level of how they can be of service, right? And if that's just ingrained into the practice of how they go throughout their day and interacting with customers, that's not a huge ask. And as far as I understand, the trainings are so simple. It's something like learning to ask yes or no questions, or redirecting instead of being frustrated, or telling the person, no, that's not right. You know, it's not correcting, but redirecting. It's being reassuring and just providing that little extra help. And so if these were already modeled in our community and people were already seeing, you know, dementia-friendly cafes, library services, and the store that they go out are already treating people with dignity and respect and with a knowledge of these symptoms and the best way to interact, then that diagnosis feeling would be more like, okay, let me take a deep breath. We are not in this alone. In fact, not only are we not in this alone, but there are leadership positions that my partner, or that I, as a person living with dementia, can step into. You know, my voice, not only does it count, but now I'm the expert on my lived situation, and there are businesses and restaurants and people who want to hear about my experience and want to make actionable changes. So I'm just excited that this is not some far off dream, but it is an achievable and realistic and practical step-by-step change that I think will come to fruition. I really think this is possible. Thank you.
Thank you, Dr. Croft. Meredith, when we achieve our dementia-friendly vision, what change would you be most excited to see? And any other closing comments you'd like to make?
Sure. Well, I just also think we're in such and the remarks from the prior speakers, just amazing. We're in such a unique time in this country where there's a lot of divisiveness. There's a lot of fear, whether it's, you know, COVID, whether it's the political election coming up, whether it's all the recognition now that there needs to be racial equity, and how can we foster that in our communities. And I think the work of dementia-friendly communities can tie in to certainly addressing social engagement, a huge issue as a result of COVID. Again, with the work of dementia-friendly communities and the importance of looking at racial equity, how dementia-friendly communities can and should play a role in that. How is your action team comprised? What efforts are you doing? Who are your stakeholders at the table? Who are you partnering with? So I think there's a lot of opportunity here, and I think people are looking for positivity. I think many people are looking to give back. And as Raina said, many people want to help. They don't necessarily know what to do in that given moment. But let's equip people with a little bit or a lot, but just starting with a little bit of knowledge. Information is power. It doesn't have to be overly complicated, but just to understand more about dementia, how to support people, how to communicate, and that we all do have a role, but it doesn't have to be an overwhelming role. It can be calling your family member or a loved one or an acquaintance and checking in on them, or if it's a care partner, it can be being more patient in a line. It can be volunteering, it can be donating, it can be anything that speaks to you. It can be certainly starting a dementia-friendly community effort. So again, you know, I think this is an opportunity when many of us are looking for something that we can do to give back to our communities. So let's start with dementia friendly. Yes, there are lots of competing priorities, but dementia friendly can also translate to other ways of life. Just as a curb cut benefited people with strollers, and it benefited people with luggage, and it benefits people delivering large packages getting over those curbs. Dementia friendly awareness and training can also benefit broader populations just from having that awareness, that sensitivity, and basic awareness of environmental factors and communication tips too.
Thank you. Thank you so very, very much, each one of you panelists and discussants, for joining us and sharing from your own perspective and really inspiring us all. I'm going to turn it over for our last 5 minutes or so to pull on questions from the audience. So everyone out there, if you have questions or comments for our speakers and discussants here, if you want to type into chat, and I'm taking a look at that right now, see what I can forward along. Seeing a lot of positive comments. We had the question about the name of Dave's book, that got answered. Here's more of a medical question I'll toss out there. Is there any evidence that childhood trauma is correlated with dementia? Does it increase risk? I don't know if this is anyone's area in particular. Anyone?
Mary Grace?
I don't know the
Can you hear me? Yeah.
Yes.
Just a note from some lectures I've heard recently, and not so much about trauma, but at the recent Alzheimer's Association International Conference, they talked about new research on lifestyle issues for teenagers. And if there's a strong correlation between lifestyle problems like diet and exercise in the teen years with Alzheimer's disease emerging much later. And there is also a lot of evidence about the research that I've read about brain injury and the eventual emergence of Alzheimer's disease, although the research I've seen correlates it with later injuries, rather less so with the younger injuries. That's what I've read.
Yeah, I'm not an expert in that area, but what you say sounds consistent with what my colleagues say, that it can exacerbate risk, but more so as you are older and you get a brain injury or you have a fall and you hit your head. So, well answered.
We have a question for Lynn. Lynn mentioned it was difficult to get a diagnosis of dementia. Why is that?
Yeah, it really depends on the community and what kind of medical professionals you have available, and if you get to the right resources early on. Sometimes it is just whether or not the provider is willing to talk about the dementia diagnosis, if they suspect mild cognitive impairment or anything else. Sometimes it's access to the diagnostic testing, especially depending on where you are in the state. If you've got access to the wonderful resources that are sometimes on the west side of the state, it really depends on the community. And sometimes too, it's the individual or their family, and just that process of ruling out, you know, what else could be going on and not necessarily wanting that diagnosis to begin with. So it can be a lot of factors, but definitely hearing from people locally, it can be a journey to get there.
And I'd like to say something in response to that question. I am a healthcare provider, and really making a simple diagnosis of some early dementia is pretty easy with some real simple tools that we use. And we have guidelines as far as what age we should start those cognitive testing, basically. And if that provider is following those recommended guidelines, when you get this certain age, we do this, we do this, we do this, and we check for cognition too. And then if we get something positive or something concerning, then we'll refer. Let's go on and refer this patient on to neurology or to behavioral health or wherever the patient needs to go. So it should not be hard. And as you were saying, Lynn, it depends on the provider, but we have guidelines that we should be following so that you get all those recommended testing, diagnostic tests and exercises at a certain point in your life. And it would behoove everyone to know at what age you should get things like breast cancer screening, osteoporosis screening, cognitive testing, what kind of lab should I have at this age? So that's something we need to teach, and we need to make sure that the community understands, because a lot of times you need to be proactive with your health care. And that's where we are these days. We got internet, we got all types of resources where we all can delve into what type of things should I be looking for at this point in my life.
Thank you. We are toward the end of our time here. I'm just going to take one more question from the chat and then wrap up and let us go on our break. But one last question, maybe I'll pose this to Meredith. So the question, it's during COVID, we're not really getting out anyways. Why bother learning about dementia-friendly communities right now? What can we really do with this information? So do you have any comment on that?
Sure. Well, oftentimes dementia-friendly communities have some type of planning stage anyway. And I think just with, we see so many of us are doing virtual meetings, and maybe you are too, the person asking the question. So this is, I feel like, a great time to start. You can still do virtual planning meetings. You can still do your community survey. You can still invite partners to the table. You can have conversations about what your strengths or gaps are. I think COVID's going to be with us for a period of time where we're just having to adapt our lives and handle things differently. But I think it's almost more of a reason because there are so many challenges right now due to COVID. Now, I understand many of us are stressed, and you got, if there are children in school and you're trying to manage work and personal life, well, maybe, doing what you can, right? You can't take on everything at once. I know there are those factors going on for people, certainly. But if you have the time, I think now it's just as important as a time as any, and perhaps more so, because we know the impact of social isolation is just so incredibly serious. Really, it can affect not just your mental health, but also your physical health. And I think that's a major issue for people with dementia who are already challenged by feelings of social isolation. So I hope it comes across that now is just as good of a time as any. Just start your planning. It's okay, again, start somewhere. But I think, if you have the time, go for it. There's no reason not to do it now.